Hello everyone, my name is O'Shea Massey. I am a second year MSW student at North Carolina Central University. I have been interning with Community Care Partners for the last 4 or so months. And today you're going to be watching a presentation that I'm having to complete for my evaluations course for my master's program. And essentially this is just an evaluation proposal or an idea for you all to think about going forward with regarding the case management program and the case management services that we provide. And yeah, that's pretty much it. So we'll get right into it. Okay, so just a quick presentation objective so you kind of can know what you're going to be tuning into today. So first we're going to just do a small little overview of CCPGM. Then we're going to look at the theory of change, the logic model that I identified, going over the big evaluation question that I came up with, as well as the actual evaluation proposal and the standards that would come with it. Okay, so an overview of the agency. So some of you may or may not know that Community Care Partners actually was established in 1983. Originally, the organization was really established to decrease the patient utilization in the ED, which we are all familiar with because most of the patients that we work with are very, very high ED utilizers. So we are still definitely doing that. But now when you look at 2019, essentially Community Care Partners is a case management services. We provide case management services, for Medicaid access to patients. And these services include a plethora of things from transitional care to pediatrics to pharmacy. The list goes on, from mental health and then subgroups from there. And then altogether, it is a team of nurses, social workers, pharmacists, community health workers, all working together to really enhance that quality of care for our Medicaid access to patients. Okay, so we're going to go over Community Care Partners theory of change. So if you don't know, theory of change is basically the methods of change through either planning or participation or evaluation that is used by a company to complete their long-term goals. So it's basically how CCPGM completes their mission, completes their goals to help patients, to help Medicaid patients. And it's basically a breakdown of how you all do that and why you all do that. So really when researching and just observing the program, it's obvious that CCP has a patient-centered care model, right? So everything is based on taking care of the needs of that patient. And then with that, our expected outcome really is to increase the quality of managed care quality. Overall, I feel like anybody that's working in the healthcare profession, our number one goal is to increase the healthcare, experience for all of our patients. But for us specifically, for the case management services or programs specifically, we are looking to really increase the quality of managed care that we provide. And then looking at why we do it, it really stems from the research and data that shows that patients that are enrolled in Medicaid don't always receive the same quality of care that patients that are enrolled in commercial insurance or bigger insurance companies, the care that they receive. Dating back, we kind of see that Medicaid patients, rather if it's because of low income or, just being an at-risk population, they usually are not getting the same quality care that, bigger healthcare insurance companies are providing for their members. Next, we're going to look at something called the logic model. So I had to basically identify this logic model for Community Care Partners. And essentially, it's just a framework, or basically you could say like a breakdown that explains the agency's goals, the objectives, the resources, and the expected outcomes. So basically a breakdown of how the program works, how it operates, what keeps it running, what keeps it going. And if you look here, you can kind of see the breakdown. So you have the inputs or the resources. So I identified our resources as the team members, right? So the social workers, the nurses, mental health professionals, community health workers, pharmacists, I mean, the list goes on. Those professions all coming together is a big resource that Community Care Partners uses for their case management program. It really wouldn't run without that. So those are kind of the biggest resources that we use in this program. And then I also identified our participants as well, because without the patients, we would not have the program. So that's kind of obvious. And then additionally, just the systems that we use, you know, from the information that we're provided from Medicaid to working with all of the different healthcare companies from Novant to Atrium to private companies, they are providing us with the information that we need to identify which patients it is that we need to work with. So I identified all of those things as kind of the resources, or, you know, the meat of what keeps the program running. And then from there, you know, you have a breakdown of the activities. And activities is basically what do those resources do or what they provide. And I kind of hit that already, but looking at the team members, they provide the case management services to those patients. So just the different activities that they have to do, rather it be as simple as a food referral or a med rec, or, you know, home visits, or, you know, just helping, you know, patients with their diabetes or whatever it may be. Those specific day-to-day tasks that we're completing as the team members of this company are the activities that we're doing to keep the program running. And then you have your short-term, your long-term, your intermediate outcomes, or your goals that are being met, or being, you know, or we're always attempting to meet those goals. And I put here for our long-term goal, of course, like I mentioned before, if you're in the healthcare profession, your main goal is to definitely increase the healthcare experience of our patients. But specifically for the case management program at Community Care Partners, I felt like one of our long-term goals would definitely be just decreasing the utilization of case management services. So essentially, we want to get these patients in, and we want to, you know, get them on the right track and help them in the areas that they need, but get them to be able to navigate the system, be able to navigate and understand their insurance and the things that, you know, they have, the resources that they have, so then they can no longer need our services. So I definitely identified that as a long-term outcome for us, with the short-term and intermediate really being, you know, those daily goals that we're working with those patients on, those daily things that we're trying to get them to do, if it's exercising for a week, or, you know, or eating healthier. Those I more so identify as the short-term or intermediate goals. Yeah. Okay, so now we're getting to the evaluation question. Myself, as well as my supervisor who was working over me, who has left, Tabitha, we kind of came up with this question just when discussing, you know, well, what could we evaluate about the case management program? And just with talking with her as well as other team members, you know, a big thing that everybody talked about was the patient experience. Like, what is the patient experience like when working with our case management services? And so a big thing that we talked about is all of the different team members that kind of have their hands in the pot of the case management process. So, you know, essentially you have one patient that goes into the ED, and then so from the ED their name is pulled, and then they're sent to the program or the patient coordinator, and then the patient coordinator has to reach out to them to then ask them if they want to accept services for a care manager. Then the care manager reaches out to them, and then as the care manager is speaking with that patient, they learn that the patient needs a food referral or transportation or whatever it may be, and then they have to refer them to the community health worker, and then the community health worker, you know, so everybody is kind of having their hands in the pot with this one patient. So we really wanted to look at the cohesiveness of all of our team members together, and how is that decreasing the gaps in case management services, or even if it is decreasing the gaps, is it decreasing the gaps, is it increasing the gaps? You know, we just wanted to kind of evaluate what that process looks like. So we just really want to find out what is working the best for the patient, getting feedback from them. Is it working? Do they feel overwhelmed with talking to so many people instead of just having one person? Is it possible to have it where there only has to be one team member? It's kind of like a one-stop shop, and one team member is able to kind of address all the needs that the patient has, so we don't have to refer and refer and refer. Essentially, that's what the evaluation question is. Does the current cohesiveness of the agency team members decrease the gaps in case management services? I hope that makes sense. That was a mouthful. Okay, so now the program evaluation proposal. So what would we do? How would we do it, right? So essentially, to evaluate, we have to collect data, and everybody loves collecting data, right? So I thought, just from talking with all the stakeholders or team members, my supervisor, some of the community health workers, some of the nurse care managers that we have on our team, just talking, I felt like a qualitative design survey would be the best kind of way to collect the data. And this would just be questions regarding feedback on the case management process. I also thought it would be valuable to not only get the patient's experience, but also the team members' experience. Just from talking with team members, from talking with them, it's kind of what made me think that this would be a good thing to evaluate. So it would be questions for the patients, just regarding their experience, how they feel about it. Do they need all those people working with them? Do they feel like it's beneficial? Do they feel like it was too much? And then once we get that information, having the qualitative design will allow us to get more so common themes and feelings of the participants of the survey, so we can kind of get a general idea of how everybody's feeling. And then once we have a kind of a summary of what that data would look like, the next steps would be figuring out, is there something we need to change in the program? Is there a process that we need to change, just tweaks, or do we need to throw it out and completely redo it? Or it might just be perfect and we keep it the same. That's also an option as well. So when looking at the survey, we have to kind of look at the standards of the survey. So this is just kind of to let you know how the survey would work. So of course it would be anonymous. We would not be collecting any patient information. We would not be violating, any patient information or IPA, anything like that. It would be voluntary with consent. We would, ask them to sign consent forms, just asking if they would be okay with giving this information. And the data would be collected essentially by team members. So since we're already interacting with those patients, instead of necessarily sending out a survey after, they're done with their case management services, over the phone, maybe towards the end or closing out that specific case, with that patient, we could take time to kind of ask them these questions in the survey about how they feel about the process of the case management department. And essentially that is the gist of my presentation, the gist of the evaluation proposal that I think would be really cool if we were able to do, just to kind of see where we are as an organization together and see how our program is running. So thank you all so much for listening. If you have any questions, please don't hesitate to email me. I won't see a lot of you because I am on I'm going to be, after this week, on my Christmas break, so I won't be back till January. So if you have any questions or comments, please feel free to email me. In addition, I really need you all to complete a survey, and the link to that survey, which is a Google survey, is attached in the email that you received with this video, and it should be really quick. It's just asking you for feedback, literally feedback on this survey. Nothing about necessarily the evaluation or anything like that, but just some general feedback that I could use to better myself as a professional. And that is pretty much it. So thank you guys so much for watching, and I really appreciate it. I hope you all have a great holiday, and I will see you all in January. Bye.